What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're covering what is the most picky or very niche specific doctors you'll get to work with that request views like out of the norm, like that aren't usually the norm. So to give you context, I am a night shift X-ray tech. I work in the emergency room and I hold down the hospital during the night. Dabble both in day shift and night shift because of monies. You know, you like the monies, especially being a young person, this economy. But anyways, I would say out of all of them, the surgeons and the orthopedics are the most very, like they are very nitpicky and very specific and they'll like throw in extra views that usually if you work at a normal hospital usually don't do, unless you work at maybe a certain place where like ortho, like if you work just at ortho you're kind of used to it, but everyone else outside of that usually we don't. And what I've noticed being because like every couple of years you get a new batch of certain doctors, new batch whatever, and what we've noticed is that the surgeons get very, very particular and very nitpicky to the point where you have to involve other people. So like, let's say you shoot a C-spine, post-surgery C-spine. Usually, they want to see the placement of the, what is it, like C2, C3. Well, it all depends where they broke their neck. And they want to see where the screws, how they aligned, and if they're in place. Usually a lateral C-spine. Usually because they're post-surgery, you just do it portable. You'll get an AP. I mean, sometimes they say just lateral, but as an X-ray tech and for the rad, you always want minimum 2 views, regardless of whatever, any minimum 2. AP and lateral, bare minimum. So sometimes they'll order it and you'll shoot it. And you look at it, and maybe the patient isn't exactly in the best condition. Maybe he's hurting. Maybe like there's a lot of variables why it couldn't be perfect. But like you look at it, and you're like, this is an average C-spine. I would probably turn in the ER normal. You turn it in, the rad reads it, and it says da 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 placement of screws, whatever. Good. But the doctor or the surgeon, whoever it is, will order it again and be like. And then it's like lateral. Or they'll ask, can I get a true lateral? So then you're like, okay, let me, anytime anyone makes you reshoot anything, you're like, let me look at it again. And then you look at it. And then you compare it to other X-ray orders that maybe the person got. And then you look at it and you're like, Sometimes you look at it and because, you think in skills, you're like, okay, how can I improve this? If someone showed, like, you rewired your brain to think about, like, back in the X-ray school days, and you're like, okay, how could this be improved? And you're like, okay, I could do this, I could do this, I could do this. Okay. So sometimes you go and shoot it again, right? You're like, okay, I tweaked all the things, and now it looks a little bit better. And sometimes the surgeon will still, once again, you shoot it, report get read, same thing, report will probably say the same thing, and the surgeon will order it again, and then once again they'll say like true lateral or da 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 da. Sometimes they'll call you. We've had a situation where a surgeon or a doctor will call us and you'll get straight disrespected because like no one, well, some doctors I've heard them cuss. Usually that will occur if you work in surgery. And some of the surgeons get very, very nitpicky and very privileged, so they'll start disrespecting you to the point where you have to control yourself if you want to have a job. Because if you presume to match their energy, you're probably not going to have a job. Because the sad part is we can be replaced. The surgeon, there is very few. It's harder for a doctor to get, like, I figured it out talking to my lady who's also a nurse. Like, it's harder for them to acquire a doctor versus like to acquire anyone else in the lower part of the like medical world. Like, it's more harder for the doctor to get fired. Like, for them to get fired, they have to do something and like very, very bad, and like it has to go through levels. But it's more easier for you to get fired than them. So like you can't, even if you get disrespected like that, all you can do is talk to your manager, get him involved, and go through the hierarchies. One time, one of our techs got disrespected like that, cried, and we got involved with our manager. And the sad part is, he looked at it and he's like, you know what? That's a pretty good X-ray. Like, that is, like, that's the best we could do. We did it 3 different times, and we have certain surgeons that are like so very picky. And which, I mean, I get it. They're surgeons. They're good at their craft. They want only the best. But sometimes the patients aren't exactly in the best. Because, like, I've noticed from time again, certain doctors will order stuff and they want certain, like, views or certain stuff. And they don't sometimes think what it took to get that picture and what it like, sometimes they don't. I've noticed so many times, especially like doctors in certain parts of the hospital where they're not in the facility or they don't see their patients, and they'll order stuff and expect stuff, but they don't see like this is probably the best you're gonna get, or like outside factors that doesn't even involve if the patient's messed up, like if the patient's mean, being disrespectful, all the other factors. Sometimes they don't think about that. They just think about, this is what I need, get it for me. And sometimes that gets kind of frustrated. Ain't even gonna lie to you. And that's like, you deal with that all the time. All you can do is like, I'm gonna do my best. I'll probably shoot it again to you. And depending on how long you've been doing this, you can be like, you know what? I'm not gonna do it. I'm gonna just talk to my manager and da-da-da. And it will kind of vary on the hierarchy it goes. But sometimes that will happen. And usually that never happens to us, and it's only certain. Like if that happens, it'll be very particular doctors, and then you'll start talking to other people who worked with them, and they're like, yeah, he's a da 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 doctor, or he's a da da da, and they'll kind of get blacklisted amongst the other workers that are below the doctor status, and they all kind of know that these certain doctors are very picky, and then if you just do a little research, sometimes what ends up happening, these surgeons or these end up having to jump hospital to hospital because something happens and they get fired and stuff. So yeah, it's been your room, Miguel. See you on the next one.